Hi, my name is Dr. Jim McKee, and I'm really excited to be part of the Seattle Study Club program, and I look forward to seeing you in our classes. I would love to share a little bit about my path. It's interesting to look back at it. I was a small neighborhood practice, and when I really started to understand the impact occlusion had on my restorative practice, my practice started to move in a certain direction. As I built on that and started to understand the impact that the temporomandibular joints have on occlusion and the restorative part of my practice, it really took my practice to a different place. From there, teaching has really allowed me to be able to continue to develop ideas and to share concepts with dentists. And I guess the real driving force of making this type of dentistry become more mainstream is really it's the best thing for the patients. I've seen patients spend a lot of time and money on treatment options that really didn't have a very good chance of working. And I guess part of the excitement about this is that we can offer solutions now to patients who have legitimate problems that we can treat. Study club learning is really, I think, looking back, one of the key factors that allowed me to implement the concepts that I had learned. I was fortunate to learn from some of the best teachers in dentistry. I attended the Pankey Institute, I attended the Dawson Academy, I learned from Mark Piper, I learned from John Coyce, I learned from Frank Spear. And while most of the time as dentists, our continuing education is in a larger platform, more of a lecture style with more people in the room, that becomes a challenge bringing those concepts back and implementing it into your practice. One of the reasons I started a study club, honestly, was to try and implement the occlusal concepts I learned from Pete Dawson. And looking back at it, study club learning fulfills the need and the ability to implement the material we hear in our lecture courses. So for me, study club learning, I think, is just really a key aspect of building a sustaining practice. I love this question because I think it really leads to some of the frustrations that we see in dentistry. Most of the time we're very technically trained, and if we present a treatment plan, in most of the cases we see, it's going to be a correct treatment plan. The problem is sometimes the patient doesn't understand the problem, so quite frankly, our solution doesn't make sense. I learned that early because it was one of the obstacles in my implementing concepts because I didn't understand which patients were ready to hear the message. And sometimes patients will never be ready to hear the message, and we have to be able to recognize that. Our job is to meet patients where they are, try to do the best job we can to educate them so they understand the problems, and therefore our solutions will make sense. So, really, I think the technical aspects are important, but really, the non technical aspects of listening to the patient and addressing their needs are really the key to implementing these concepts. I really think that's another great question because really what I've learned over the years is that if we're going to implement the clinical skills we are learning, we have to be able to communicate those effectively, not only to our patients, but to our staff as well. You mentioned team training, and I'm going to touch on that just for a second because so many times dentists will say, I'm burnt out, I'm tired, I can't keep doing this. And I think that one of the things that we can do is help develop our staff to help us do all the things that are necessary to run a practice. So I think really looking back at it at the big picture, it's not only the technical aspects with the patients, but it's being able to motivate your staff, to train your staff, to allow them to help you have a better work-life balance. That's really the advantage of it. Having staff members that were trained well and could do their job allowed me to have time at home and get out of the office earlier. So that's really the main advantage of putting not only the clinical part together, but the communication part, especially with the staff members. The legacy of the Seattle Study Club is interesting, because it's really been the premier study club program throughout the world. I've been very fortunate to be part of Seattle Study Club symposiums in the past, and they are some of the best meetings I've ever been to in dentistry. This is going to be a very specific curriculum, I think, that you're going to see developed that's going to address a lot of the issues that we see on a regular basis in our practice. And the thing I like about it is that it covers different disciplines. Sometimes, especially at teaching centers, you see people and concepts be pigeonholed into one certain thought process, you're going to hear a number of different clinicians speak about different techniques in different disciplines. So you're going to get a wide range of information that I think is really going to enrich your learning experience. That's really why I'm excited to be part of this, and I'm very honored to be part of it. So I'm really looking forward to a great program. In order to change how we practice, I think two things have to happen. First of all, conceptually, the ideas have to make sense. It's kind of the same thing as if we're talking to a patient. It has to make sense. So once we understand the concepts, which really, to be completely honest about what we're going to talk about in occlusion and TMD, are pretty straightforward. If you can look at an MRI and a CT scan and understand the anatomy, you can pretty much do whatever we're going to talk about in this class. And it's going to increase your practice in a huge way. But basically, after we understand the material, we have to transfer to our hands. That's why I like this format, because we're going to have a combination of not only lecture, but we're going to have a lot of hands-on exercise that are going to allow you, when you go back to the office, to know what it feels like when you're doing this on a patient. So it's going to be a great format. I'm really excited about it. Well, it's interesting that we talk about occlusion and TMD being intimidating, because that's exactly how I would have described it when I got out of dental school. And if you talk to most dentists are going to tell you the training that we get in occlusion and TMD is not very strong compared to the other disciplines in dentistry. And I think that's reflective of the profession as a whole. I think if you asked most dentists, they would say this is the area that they are the least confident in. I think part of the reason is we've been looking at the wrong end of the horse, if you want to talk about it that way. Because we've always thought that if you had a bite problem, it could cause a joint problem. I think today, we know it's the other way around. If you have structural changes in the jaw joint, which a lot more patients have than we think, many times the change that we see is in how the teeth fit together. A malocclusion, a class 2 malocclusion, an open bite, a canted occlusal plane. If we can recognize those problems, now we can start to solve patients' problems and offer them solutions that really become more predictable. Becoming a complete clinician is really the challenge for most dental practices. And if you talk to dentists today, one of the things that they'll tell you is that one of the challenges is creating a well-trained staff that gets along with each other and stays with the practice. I mean, honestly, that's the challenge as a private practitioner today, is to develop staff members that can allow the patients to have a better experience and increase the efficiency of the practice. If we think about it, when we look at payroll, it is the highest number on our profit and loss statement. Now, I don't think of it as an expense or a loss. I think of it as an investment. I don't want to invest in people. I want to invest in my staff. So routinely, my staff was paid more than they could get at any other office. We had a retirement plan. We had a very liberal schedule. However, in return for that, when they came to the office, they were 100% on board, and they were able to communicate concepts to the patients very effectively, and they were able to do their clinical aspects at a very high level as well. So I really enjoyed my relationship with the staff, and I think it can be developed a lot easier than we think. If I had to look forward and say, how would people change going through this or these programs, I would probably say it's going to be in confidence. When I look back at my experiences, as I started to recognize more issues dentally and I was able to address those with a higher level of success, my confidence levels increased. It changed the way I talked to patients. It changed the way the patients heard me. And the more it happened, the more it built upon itself. So in my particular concept, or the clinical concepts that I'm going to be talking about, is going to revolve a lot around understanding the occlusion at the tooth level as well as at the joint level. When I was able to marry those two thought processes, of the fact that the mandible has to fit together at the tooth level and at the joint level, really all the difficult cases kind of went away because now we had an understanding of why the teeth weren't in the right place, maybe why the skeleton didn't grow, and now we have answers that work. So I would say confidence is going to be the biggest area that you're going to see a change in, and it's really an exciting change in your practice when it happens.